Hi, class. It's Dr. Lindner. Welcome back. We're going to take a look at anemias. And the term anemia is defined as a disorder of the blood that's characterized by a reduction in the production and number of red blood cells and a reduction in the production of hemoglobin, right? If you have a decreased number of red blood cells, then there's less hemoglobin, less oxygen. There's going to be some downstream effects of that. So the most common types of anemia are going to be blood loss anemia, a gunshot, a lesion, a wound, post-surgical, an ulcer within the body, right? All these things need to be investigated to find out if it's blood loss. Aplastic anemia, megaloblastic anemia, hemolytic anemia, iron deficiency anemia. So in terms of blood loss anemia, it's characterized by a reduction in the number of red blood cells, and it can be caused by, as I said, like a gunshot, a stab wound, some sort of trauma. When women are menstruating and there's heavy blood loss, heavy menstruation, internal bleeding, either there's an aneurysm, like a ruptured blood vessel, a gastrointestinal ulcer, things of that nature can show up as blood loss. In terms of aplastic anemia, this is caused by a reduction in the red bone marrow activity. This can happen as a result, most likely from chemotherapy, radiation therapy, also from advanced aging, but most commonly we look at that with people with cancers that have been under chemo. There's another condition called myelofibrosis, which is an autoimmune disorder, is when the body attacks the bone marrow and it just turns it into non-functional tissue or fibrotic scar tissue. Megaloblastic anemia is the result of reduced dietary B12 or folic acid. So you're looking at B12 or B9. This is when the red blood cell appears larger than normal red blood cells, which is megaloblastic, megalo, right, large, with normal to slightly reduced coloration. Whenever you have reduced coloration, they use the term hypochromic. So the pathophys of megaloblastic anemia, it's caused by a deficiency, typically in vitamin B12. When it's a cause from B12 deficiency, they typically use the word of pernicious anemia. Pernicious anemia is the most common cause of megaloblastic anemia, although the disorder is found in people of all races and ethnic groups. It's most commonly found in individuals of Scandinavian, English, and even Irish ethnic extraction. Pernicious anemia is also common in Blacks and Hispanics within the United States. The underlying cause of pernicious anemia is a defective gastric secretion of something called intrinsic factor. Remember, intrinsic factor is produced by some of the cells within the stomach. Intrinsic factor is a glycoprotein, and it's produced by these parietal cells. Now, the parietal cells are found in the gastric lining of the mucosa, and you need intrinsic factor to bind to B12, and it's going to transport it to its next pit stop throughout the intestines. Okay, and it's finally absorbed somewhere around the ileocecal valve in that region where the ileum and the cecum come together. That's where most of the B12 absorption takes place, which is why a lot of people with Crohn's disease and it attacks that region can have a malabsorption of B12. Besides that, the intrinsic factor can also be affected in people that have atrophy of the gastric mucosa, and atrophy happens when people get a little bit older. The lining of the stomach lining starts to atrophy a little bit. So if it's atrophying, you're going to lose some of those parietal cells. You're going to lose the ability to produce intrinsic factor. a lot of the supplementation today of B12 typically has intrinsic factor with it. About 90% of all individuals who suffer with pernicious anemia demonstrate parietal autoantibodies. So it's like their body is attacking the parietal cells. Chronic gastritis that's caused by alcohol consumption, sometimes foods of extreme temperature, and even smoking. These can also cause gastric atrophy and pernicious anemia. People who have gastric bypass, or they have the size of the stomach reduced, also are going to have B12 issues, B12 absorption issues, which can result in anemia. B12 is extremely important for methylation. Methylation is important for weight loss, for neurotransmitter production, for DNA synthesis, RNA synthesis. Methylation is extremely, extremely important. So you have to be really careful when playing around with the stomach, reducing the size of the stomach. And if so, you have to be very, very smart nutritionally and with proper supplementation. The characteristics of megaloblastic anemia is large, normal colored red blood cells. So they call it normochromic, macrocytic, but there's a decrease in the hematocrit and an increase in the mean corpuscular volume. Pernicious anemia develops slowly. That's what pernicious means, slowly developing. It's quite severe at times, and it can result in early symptoms, including susceptibility to infections, mood swings, gastrointestinal issues, cardiac issues, kidney issues, and obviously fatigue. Here's just a look on the left-hand side of pernicious anemia. These are larger megaloblastic. And on the right is the normal cell. You can see it's a little bit hypochromic in the center, but these on the right are normal size. On the left side, they are much larger. Iron deficiency anemia is as it sounds. Iron deficiency anemia, these are small to normochromic to slightly hypochromic red blood cells, and it's caused by the inability to absorb dietary iron. Low stomach acids. The individual could be on PPIs, which are proton pump inhibitors. Proton pump inhibitors. Protons are, if you look at hydrogen, hydrogen is a proton. So when you add hydrogen to chloride, you have hydrochloric acid. So if you're blocking hydrogens, you really can't get enough stomach acid, right? More hydrogens equal more acidity or a lower pH. That's why the pH of the stomach is around 2.3. But if you use proton pump inhibitors and you block the protons, then you start to raise the stomach pH. It becomes a little bit more alkalinic. When you use PPIs and you affect the pH of the stomach, there's going to be bacterial overgrowth in the stomach. There's going to be the inability to break down proteins. So have to be really careful with proton pump inhibitors. Iron deficiency anemia, also seen with people with infections, whether they're viral, bacterial, because they're going to feed on iron just like COVID did. And that's why people that had it were just so exhausted and tired and fatigued because very, very low iron. Really important. I always check my patients for their serum iron, their ferritin, and vitamin D status for sure. Some of the signs, physical features, if you look at the nails and you look at the nail bed, it should be nice and pink. Here it's white. So if we see this pale or white and not red, that's a good indication of anemia. When you pull down the eyes, this should be nice and red and pink. If this is white, if you stick out the tongue and the tongue looks white, you start to see a pattern of all of those with fatigue and irritability and mood swings. You're thinking that there's an anemia, especially in iron deficiency anemia. Can also use a pulse oximeter. If we start to see the oxygen saturation start to dip, 92, 93, 80%, these are very, very dangerous levels. Should always be 96 or better on oxygen saturation. On the left-hand side, this is iron deficiency anemia. You can see how it's really hypochromic compared to these cells on the right-hand side that are normal. Okay, when we come back, we'll look at white blood cells.